Kelsey. She is a massage therapist and works in St. John. She's amazing. Like, she just is so great, and decided that she was willing to come on and talk to us tonight and go through kind of all of the things about massage that you really don't think of, because when it comes to pre and postnatal massage, it is not just like, hey, I'm going to go get my back rubbed and feel good. Like, there's actually so many benefits and so many things that can help, like with healing postpartum and C-section massage, and then in pregnancy, actually like helping to get your muscles in a good place and do all of the things.
So this one would be if you have some glute or lower back pain, which I'm sure we all do. So you want to do this one seated. There's 3 variations I'll show you. The way you're going to do this stretch depends on how big baby is and your flexibility range. So everyone does it differently, and that's okay. If you want to stretch your left hip, you guys probably seen this before. You're going to take your left leg up on your foot. You can add some overpressure down through this knee, and then you're going to want to hinge forward at the hips. Depending on the state you are in your pregnancy, this might not be happening for you. You might feel the stretch here. Awesome. You can hold this stretch for 30 to 60 seconds. Repeat on both sides. You can push down that knee for increased pressure. Bend forward at the hips. I will mention with this stretch, so we're stretching glutes and lower back. The longer you hold the stretch, the more likely it is that you will feel the stretch increase into your lower back. When you first do it, you might just feel in your hamstrings, and that's okay. You're probably doing it right. You probably just have really tight hamstrings. So just like hold it, let that stretch work itself out. It will grow its way up through your hamstrings, up to your glutes, up through your back. Once it all stretches out, it's kind of a gradual thing. Not uncommon in the stretch if you feel any tingling in your bum or leg. We're stretching the muscle that runs over the sciatic nerve. So understandably, if you're really tightening a muscle that runs over a nerve, gonna kind of irritate it. It should go away. I just had it now when I was doing it personally. I have pretty healthy hips, so it's not uncommon. It went away immediately when I get out of the position. So do it if it's tolerable for you. If it's something that's super uncomfortable for you, like I said, like I don't believe in doing things that are uncomfortable for you. So just rock on to your thing. If that is inaccessible for you because baby's big or you have decreased flexibility, so we're gonna do it laying down. So we're gonna lay flat on our back. If we're stretching this hip, it crosses over. So I'll show you in this position. This is what it looks like. And then you're gonna wanna grab, so I'm just switching legs. You're gonna wanna grab the leg that's there and pull that towards you. That's the exact same stretch, just a different position. I'm personally a lazy stretcher, so you'll find me on the ground always. Because I find it's a little easier to hold that for a prolonged time. You can just lay there. If baby is too big and you're having trouble reaching your leg over your belly, take a towel and wrap it around this leg, the one that is not bent over, and then just pull the towel towards you. Either way, you should find a stretch. Everyone's anatomy is super different. Sometimes we need to wiggle a little bit to feel a stretch where we want it. Never stretch into pain. If you have sharp pain with those, like stop, something's going on. Stretch very gently. If you don't feel it where you want to feel it initially, like I said, hold it in the stretch. You might just have really tight hamstrings. They need to stretch before you stretch your glutes. That's okay. It's okay. You get a 2-in-1. Another stretch I'd like to show you guys.
Can I just ask something real quick?
Yeah.
So if people are having an issue laying flat on their back, do you recommend taking a little pillow or towel or something underneath that hip?
100%. Yeah, that's something I forgot to mention. But yeah, if you find it super uncomfortable to lay on your back, I'm comfortable treating patients or pregnant patients on their back as long as they're comfortable with it. Usually what I do is just slide like a folded towel under that hip. It's just the slightest tilt, but enough that the belly is clearly pointed to the left side. And if it's a position that makes you uncomfortable, don't do it and opt for the seated one. Or you can get your partner to help you do it, like sideline maybe.
Yeah. So that would be like any type of nausea, dizziness, feeling kind of crummy, or shortness of breath. Those are like your big signs for you are having your big vein squished by baby. So move off.
Yeah, not worth it. Not worth it. Yeah, there's other ways to stretch that bad boy. And one more, another stretch for your lower back pain. You guys have probably heard it's a nice position to labor in as well. I'm gonna do a nice child pose. So this one's really good. What you want to do here is kind of like, I push my hands on the ground to push my hips back. Instead of falling like this, I try to go as deep as it is possible. So you guys are going to have a beautiful belly, and you're going to want your hips important to be wider than your torso. Sometimes we see people doing child's pose like this, and that's cool, but it's not really getting the result we want. So hips wider than torso, lean back into it. I don't have a bouncing ball here with me, but there is the option to do this holding onto a bouncing ball here and kind of lean back into it. If you have a partner with you, they can put some pressure down on your sacrum here. It feels really good. That's a good position to labor into. You guys might have discussed. It's a really accessible position for your partner to do like a hip squeeze while you're there, or like maybe some back massage or whatever feels good for you. So this is the one, if you're having SI pain, this is going to be your friggin' jam. I give this to all of my clients, pregnant or not. Anyone who has SI pain is getting this. So the, excuse me, Rose. The important thing is that the chair is pushed up flat against the wall, because we're going to be doing a driving force through the knees. So it's not against the wall now, it is. So Jared's sitting, tall spine, knees are at 90 degrees, which is important. His feet can touch the floor. I've done it on people who have really short legs and their legs aren't touching the floor, but it is ideal that your knees are at 90 degrees. And so I'm going to be doing the active force. Both my palms are on his knees, and we're pushing straight through his femur. So as if you could see, you probably can't see, but he gets a little taller when I do this, just because his sacrum is actually going into a better position. And yeah, you're going to feel really awesome. Thank you, Jared.